This year on the 29th of September, we are celebrating World Heart Day.
Now, such days are actually celebrated to make people aware of different diseases and also know the steps on how to recognize them.
You know, I can tell from my personal experience of being a cardiologist that heart disease is very rampant in India. It's actually an epidemic. It affects everyone, young people, old people, people of different socioeconomic strata. Everyone has heart disease, and that's why it's very, very important that we know and understand what it's all about and what are the steps that we can take to try and prevent it.
Absolutely, and that is why on the occasion of World Heart Day, we will tell you about 5 numbers that you should know about your risks for heart disease. I'm Dr. Sonia Lal Gupta.
And I'm Dr. Sameer Gupta, and welcome to Doctors on Call. So we're going to talk about 5 numbers that you should know to assess your risk of heart disease. Well, the first is the waist circumference. You know, in India, we generally have a tendency to accumulate a lot of fat around the belly. Everybody has a paunch, and that is actually very bad. It's harmful. And if your waist circumference is more than 90 centimeters for men or 80 centimeters for women, then you have a high risk of heart disease. That comes to about 34 inches for men and 31 inches for women approximately. It's one point to remember. It's important to measure your waist at the level of the belly button, not the pants you wear, but at the level of the belly button. The second number, your blood pressure. A high blood pressure not only increases the risk of heart disease, but also of stroke, eye problems, kidney problems, and a whole host of other issues. The simplest way to measure your blood pressure is using a blood pressure machine. It's available commonly. You can get it at your local pharmacy, get it checked at a doctor, check it anywhere, but check your blood pressure. A normal blood pressure is 120 over 80, and you're diagnosed with hypertension if your blood pressure is more than 140 over 90. But even a blood pressure which is not hypertensive, that is your blood pressure is more than 130 over 85, it increases your risk of heart disease. The third, your cholesterol and your HDL level. Now the cholesterol is the yellow blacky substance that you find in your blood, and it's very important for you because it forms the linings of your cell, it forms the hormones, but not always. A high level of cholesterol is bad for you. Now the blood has different types of cholesterol. The LDL is bad for you and it forms blockages, so you want your bad cholesterol number as low as possible, and your HDL, which is the good cholesterol, you want that high. But if your LDL cholesterol goes high and is more than 160, that increases your risk. And if your HDL cholesterol, which is the good cholesterol, if that is less than 40, that means you're at a high risk. Number 4, your fasting plasma glucose. Now the glucose level in your body is a complex interplay of different hormones, including insulin. Now an increase in your fasting blood sugar is a marker of insulin resistance that increases your risk of heart disease. Now a normal fasting blood sugar should be less than 100, and if your blood sugar is more than 125 at fasting, that means you have diabetes and a higher risk of heart disease. Number 5, the triglyceride level. Now when you check your lipid cholesterols, you also get a number called triglycerides. These are also present in the blood, and a high triglyceride level, which is more than 150, increases your risk of heart disease. So let's try and put all of it together. So we talked about 5 factors, and one of them was waist circumference. Now if you have a high waist circumference, along with any of the other 4 risk factors we talked about, it could be high triglycerides or a low HDL or your high fasting sugar. So if you have high waist circumference along with any of the other 2 risk factors, then you have what we call in medical terminology metabolic syndrome. So when you have that diagnosis, you actually have a very high risk of having diabetes or even heart disease.
Absolutely, but by eating right, exercising regularly, and most of all, making right choices, you can definitely reduce your risk.
And it's very important to take care of your heart. After all, it's working tirelessly for you and with you. Well, we hope you learned something today. That's all for now. See you next week.